compelling was the very first day I ever worked in this small clinic. It's called the SIF clinic outside of Port-au-Prince in Croix-de-Bouquet. The very first day I was ever acting as a surgeon in Haiti. I was with an anesthesiologist who I didn't know. I was with this team that I didn't know. I hadn't met them before. I just knew that they needed a general surgeon to come and help on this trip. And didn't know the country, barely knew the language. And when I saw the clinic we were working in, it was a tiny place with a tiny little operating room where the lights would sometimes flicker because the energy was not always reliable, and a small operating room. The equipment was antiquated, but you know, I assumed this is what I was going to face. I still had a roof over my head, and the anesthesiologist I met seemed to be a very competent guy, and the team, the nurses were wonderful. We hadn't started to work yet, but we had to start to see patients. So the missionary, the lay missionary who was overseeing the clinic, she brought us to this tiny little room as big as a closet. And she said, you know, this is the emergency room, and this is where you will see patients. So I said, okay. And we started to see patients, mostly with routine issues. We had an interpreter. You know, routine issues like hernias or small fatty lumps on their hands or other things that would, again, not mean that much, would be easily fixed in the United States, but were transformational to these Haitians to be able to see a team that would be willing to help them with these issues. And it was about 10 o'clock in the morning. It was very vivid in my mind. The lay missionary comes in and she says, "Dr. Coletta, we have a real emergency." And I'm in this closet-like emergency room, and I'm like, "Really?" She says, "Yes, we have a gentleman who's in a tremendous amount of pain, and he looks very sick." I said, "Well, you know, let's bring him in." And so they brought him. This was about a 55-year-old gentleman, a father of 5, from one of the huts just out, not far from the clinic. So one of these folks that lives on $1 a day, but a father of 5, and he looked very ill. And it was immediately apparent to me that he had a hernia where likely part of his intestine had become trapped. We call it in the United States an incarcerated hernia. A very critical problem. If you don't take care of it right away, the intestine can perforate, people can die from it. And it was so painful that I wasn't able to push it back or relieve his pain. It was stuck. This is the kind of thing in the United States, you might get a CAT scan to see if the bowel is dead yet or not, does he need a major surgery or not, all kinds of things, you know, blood work and cardiology consultants. We didn't have any of those things. We just had the anesthesiologist and myself. And we had the nurses, and I knew we had oxygen and a few other things, and I said to the missionary, "We need to get him to a hospital." And she said, "Nobody will take him. There's no hospital that will take him. He can't pay for anything." I said, "Well, what?" She said, "Well, we'll take him back, and we'll keep him comfortable, and he'll die." The father of 5. And I said, "Well, he's not going to die on my watch. You know, I can't, you know, accept that." So this is my first day. So I said, "Look, why don't we bring him into the recovery room? We'll give him some sedation, because sometimes if you give patients sedation, they start to relax, their muscles relax, and you can push the hernia, the bowel back in where it belongs and relieve the pain and the pressure. And if we get to it in time, he'll get better. If the bowel has already been compromised, he'll just get sicker, and maybe we've done as much as we can, but we have to try." So we took him to the recovery room. I explained to the nurses what we were going to do. We sedated him. I said a prayer and worked, and it popped back in. I reduced it. So I said to the nurses, "Now we just have to see how he does. You know, as he wakes up, let's watch his vital signs and see if he feels better. And we're going to go back and see patients in our emergency room. And you know, you keep me posted on how he's doing, and we'll just take it one step at a time." And in about an hour, the nurse comes back, and he's sitting up. He's smiling. He feels much better. You know, he's not getting sicker. It seemed to me without the use of a CAT scan, we didn't have the ability to know that likely everything, we got to him in time. So that afternoon, I said, look, we have to fix this hernia now, because we don't want this to happen again. And we fixed it. And the Haitians have this incredible tolerance for pain. So shortly after we fixed the hernia, which was my very first surgery ever in Haiti, with a team I didn't even know, but we all worked together really well. He recovered fine, and the missionary had a truck, and he wanted to get home to his family. His wife had been there the whole time, obviously very frightened that she might lose him. We all hopped in the truck and we took him home. We brought him back to his hut, and his wife came out. She didn't speak any English, but she gave me this immense hug, and we saved his life. The very first day I was there, and it just seemed to me that there was a reason why I was there, and it's the reason why I've always gone back. It just was a day I'll never forget, because without that team being there that day, that particular moment, that father of 5 would have died. So it's an example of what we can do transformationally, one patient at a time. We may not be able to cure the problems of the country, but we can certainly bring that kind of health and healing to people who would otherwise never have it.